Dear students, welcome back. In the previous session, we have discussed about the sole of the foot. In that, we have discussed about the skin and the superficial fascia and the cutaneous nerve supplying the sole. In this session, we are going to discuss about the modifications of the deep fascia. So, the deep fascia of the sole is specialized to form the plantar aponeurosis in the sole. And next one is the deep transverse metatarsal ligaments, and the fibrous flexor sheaths, which is also homologous with the fibrous flexor sheaths which surrounds the flexor tendons in the fingers. Okay, now we are going to discuss here is the plantar aponeurosis. So the deep fascia covering the sole is thick in the center. So the entire sole is covered by a deep fascia, but at the center the deep fascia is very thick. Comparatively with the medial and lateral sides, the central part is very thick. That thickened central part is known as what? Plantar aponeurosis. Okay. So here if you see this plantar aponeurosis, it is triangular in shape. Okay. The apex is proximal and it is attached to the medial tubercle of the calcaneum, proximal to the attachment of the flexor digitorum brevis muscle. And the base is distal. Okay. So here you can see very clearly in this picture. So the base is at the distal, and this base is going to give 5 slips, which each slips entering into each toe, okay, and each slip is again divided into two parts. One is the superficial and deep slip, so which is just opposite to the metatarsophalangeal joints. So each processes, that means it gives 5 slips. Initially the base of the plantar aponeurosis gives 5 slips, and each 5 slips gives again 2 slips. One is superficial and deep slip. The superficial slip is attached to the dermis of the skin, whereas the deep slip again divides into 2. So the deep slip is again divided into 2. And if you see the gaps in between each gaps between each primary slips allows to pass the digital nerves and vessels. Here you can find digital nerves and vessels are passing in between these 5 slips. Okay, yes. Now we will see again the deep slip, which are divided further into 2 slips, which embrace the flexor tendons. Here you can see the flexor tendons in the second digit. One is tendons of flexor digitorum brevis and flexor digitorum longus. Okay, so this embraces the flexors tendons. Okay, and also finally it blends with the flexor fibrous sheaths. And also the deep transverse metatarsal ligaments. From the margins of the aponeurosis, medial and lateral margins, it forms the medial vertical intermuscular septa, so which passes deeply and divides the sole into 3 compartments, and thus finally below the deep fascia there are 4 layered structures we can see below this deep fascia. Okay, if you see the applied anatomy, we can find a condition called as plantar fasciitis. So that means the inflammation of this plantar fascia, okay, which causes very severe pain and tenderness of the sole of the foot, and it occurs in persons who do a great deal of standing and walking. Okay, if the repeated attacks of plantar fasciitis produce ossification in the posterior attachment of the plantar aponeurosis, forming a calcaneal spur. Okay, this is about the applied anatomy of the plantar aponeurosis. If you see the functions of this plantar aponeurosis, it fixes the skin of the sole, it protects the deeper structures, it helps in maintaining the longitudinal arches of the foot, it gives origin to the muscles of the first layer of the sole. This is all about the plantar aponeurosis. In the next session, we are going to discuss about the layers of the sole. Thank you.